What it do, YouTube? It's your boy AmB, back at it with another one. I know it's been a minute since I made the last video, but I'm really in a crucial time right now as far as school. This spring semester, just setting up the fall, setting up your fourth year, and then just finishing off third year strong. So we're just trying to make it happen. But in other news, I'm on trauma, and today's my last 24-hour shift, so I'm so happy. But yeah, I'm gonna be here from 6 a.m. to 6 a.m. So let's see how the day goes. It's Fiesta in San Antonio, which is like a festival where people, like the whole city gets really drunk, and suppose it's a really bad time. So we'll see what the day brings. This is my 8th week in surgery. I spent 4 weeks. My first 4 weeks was at the Children's Hospital, pediatrics, and then my last 4 weeks is on trauma. I kind of get into a little bit later, kind of like what both of those entailed of, and then kind of talk about what I use for the shelf, and then just my overall experience of the surgery rotation. So stay tuned. Let's get it.
He's the department head. That's cool.
But I mean, is that really gonna get you a residency spot somewhere?
No, that's what I said. He wrote cool for school. Who the fuck writes that?
Alright, so boom, it's like 9 o'clock. The day kind of started kind of faster than I like it to. Usually in the mornings it's pretty chill from like 7 to like 2. And then people really start coming in once school gets out. From 2 o'clock to like 6 o'clock we get a big wave, and then from like 6 to 8 we get a big wave. Then it's chill from like 8 to 10, and then from like 11 to 12 you get a big wave. But this morning we already had 2 level 1 alpha traumas. So basically the setup, the way it is let's say you get into a car accident or something. At that point you have to be evaluated. So there's different categories for the level of trauma that we get. So the most serious one is a level 1 alpha. That means like the patient is unstable. Vital signs are like unstable. He's either like super tachycardic or like blood pressures in the 70s, things like that. And when you have a level 1 alpha, the whole hospital, anesthesia, radiology, blood bank, everybody comes to be ready for it. You got to put on like the special gown. You got to it's like a big deal. Got to get ABGs, got to get the chest tube thoracotomy, because if shit hits the fan. Then there's like level 1, which isn't a level 1 alpha, but it's a little bit still like not that bad, but it's not a level 2. Level 2 is basically like, fell from standing, you're stable, but we're going to check you out and make sure that you have no serious injury. So this morning we already had 2 level 1 alphas, and I'm like, bro, it's Easter Sunday, you know what I mean? Like, go to church. Like, come on, man. But nah, like I said, it's a Fiesta in San Antonio. So Fiesta is like when, like I said, the whole city just gets like wasted, and then when people drink and move around, people end up in the trauma bay. So right now I'm just going to get another cup of coffee because your boy's tired. So I'm gonna try to show y'all what the bay looks like, just so I can kind of see as well, just kind of how the setup is as well. So really quick, I'm gonna talk about my peds rotation. Peds was cool. I feel like I got to see all of like the pediatric things that you read about in books. Got to see like a gastroschisis, pyloric stenosis, G-tubes. We had a kid with like imperforate anus, had a kid with Hirschsprungs. So it was really like cool to actually see these things really be done in real life. A Nissen fundoplication for like relentless GERD we had to do in a kid. Got to see a lot of pathology, so I was pretty excited about that. So yeah, so I was on peds for 4 weeks, and now I'm on trauma. So one thing about my school surgery rotation, everybody on the rotation has to take overnight call, which is like 6 a.m. to 6 p.m. Everyone on the rotation has to take overnight call, which is like 6 p.m. to 6 a.m. And you probably have like not even 3. You probably have like 6 calls in the 8 weeks. And it's just kind of divided, like 3 students. It's kind of divided where you do like 1 every 4 or 5 days. So I had like 3 overnight calls while I was on peds. But in trauma, you're Q424, which is a fancy way of saying you're on call every 4 days. So there's 4 students in trauma. And basically when you're on call in trauma, like when you're on the trauma team, then you're there for 24 hours. So today is my last call So my last 24 hours, yeah, man, it's demanding. You know, you live off of coffee, Monsters. I'm acting totally different. I'm drinking like Diet Dr. Peppers. I don't even know who I am right now. But you gotta do what you gotta do to try to stay up. Quick things that I've learned, like in my brief experience in surgery. So, at first, when I first started surgery, my feet were killing me. Crazy. Like, I was like, dog, like, how do people stand up all day? Compression socks changed my life. Like, if you're watching this and you're about to start surgery, or you have surgery soon, or honestly, if you just stand up a lot, compression socks are the wave. The one thing, though, about compression socks is it's hard to wear them for 24 hours. So, like, right now I don't have them on, but I'll probably put them on around 3 p.m., 4 p.m., 5 p.m. Whenever my feet start screaming at me, like, yo, come on, my guy, help me out, I throw on the socks. So compression socks really made my surgery experience a lot better, because just standing up that long with no support, I wouldn't recommend it. So this is the trauma bed. So let's say somebody comes, everybody will be there, they'll resuscitate them. You'll be at the head of bed looking for injuries and all that good jazz. I can't show y'all obviously a trauma, but it's kind of like an idea. I don't know if Grey's Anatomy looks like this, but people said this is what Grey's Anatomy looks like. So I didn't really want to record like too invasively in there. There's cameras in there, and then I just feel like I don't want to get in trouble and nothing like that. But imagine what happens is somebody comes in on a stretcher. There's the resident, or that's the resident. He's at the head of the bed. He's checking airway, breathing, circulation, ABCs, which every patient gets. The medical students have their shares, and they're cutting off the clothes, feeling pulses, making sure that the pelvis is stable. If it's a level 1 alpha, then we get the ABGs, and then from there we're getting the history, because we have to get their quick medical history and all of that things. Once airway, breathing, and circulation is all stable, and the person isn't dying, you take them to the CT, so you can run them through the CT, see if they have any abdominal or any kind of issue that needs adjusting. And then from there, once it gets stabilized, then the appropriate service that needs to come do their thing, ortho, neurosurgery, OB, whatever, comes, and then they evaluate them. So it's pretty cool, man. I've seen the craziest things in my trauma rotation. Everything from dog bites, getting kicked off a horse, snake bites, obviously motor vehicle collisions, hit by cars, hit by bus, motorcycles, all of that, I will say, I feel like being on trauma changes your perspective on things. Yeah, being on trauma definitely changes your perspective on things. I'm actually going to get some lunch right now, but for example, I would never in my life ride a motorcycle. It's just, I don't think it's worth it. And the people that are on trauma that don't make it are people on motorcycles. Dog bites, don't mess with a dog that you're not comfortable with, familiar with, because dogs really do damage, you know what I'm saying? So just things like that, even being on the ladder, now I'm okay, let me make sure this is secure, because I've seen people fall off those. So part of our responsibility as trauma students is to help out in surgeries. So I just got out of surgery myself, a below the knee amputation, and a diabetic dude that had a really bad ulcer. Man, surgery's pretty crazy, man. I got blood all over my face. I was wearing a mask, blood everywhere. She was wild. So part of the thing is when you're, I guess, on your surgery rotation, is just figuring out whether or not you can tolerate the OR and tolerate the active surgery. And I think that's really one of the more beneficial things, is just to see if your personality fits, with the personality of the operating room. And I think it's really everybody's surgery rotation will be different, and whatever service you're on will be different. So you can't really, I don't think you're really based whether or not you kind of know if you like surgery or not, and your experience on your surgery rotation really can or may or not break that. Because most people, I feel you want to do surgery, you kind of know whether or not you want to do it. You can end up on a service that you absolutely hate, but doesn't mean you don't want to do surgery. That was just a stupid service. Or you can end up on a service that you absolutely love, but you're not really built for day in and day out of this like a surgery life. So kind of just have to take that into account. Just about to go grab a snack or whatever. We've had a couple traumas in the last couple hours. The thing about trauma is like everybody comes at the same time. You know what I mean? So like you'll be doing nothing for 2 hours, and then next thing you know, you'll have like a motor vehicle crash, and then fall from standing, fall off of a horse, ATV accident, blase blah. I've low-key been like pigging out during trauma. I haven't meal prepped at all like this whole rotation. Just eating straight crap, junk food. I'm gonna get back in shape. My next rotation, emergency medicine. Yeah, simple stairs killing me. I'm pathetic. Checking in. It's like 7 p.m. Been here for like 13. About to, brush my teeth because, of course, and, not gonna be out here mouth smelling like somebody's business. Somebody told me in surgery, if somebody offers you a mint, just take it, don't even ask questions. So we got slammed the last 2 hours. Just they come in waves and they come hard, but right now it's kind of smooth. So I'm gonna brush my teeth and then head back to work. So what's up, man? Back at it. Look, he just went through another wave of craziness. People find the most interesting ways to hurt themselves. Like, if I haven't learned anything from trauma, man, like, simple things, like look left, look right before you cross the street. Like, why are you just running in the middle? You know what? About to get some food. 18 hours in, got 6 more hours to go. I'm really hoping like it just relaxes a bit so I can, watch Game of Thrones. You feel me? Catch up on like what happened in the sports world. Do something. On another note, really quickly, another thing we have to do as med students in our trauma rotations was called 4-pagers, aka just like a history and physical, a trauma history and physical. And it's like a really big deal because the residents don't want to do it. And to that point, we do everything the residents don't want to do. So in the time I was gone, I watched these dudes like burn wound off, like, just busy scut work, you know what I'm saying? Watch this dude burn wound off, pack this dude shot himself in the butt or got shot in the butt or whatever. Pack that, you know what I'm saying? Watch that, pack that. Go get incentives for morality on this dude. Or tertiaries is another big thing. So basically, when somebody comes in, the primary assessment is, ABC, boom, 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 whatever. The secondary assessment is then when you like look at, other injuries they may have on their body. Then the tertiary assessment is like after like an hour or two after they've been resuscitated initially, you go back and see if there's any other injury or something you may have missed. So once the CTs have been read and all that other stuff has been read, then you go back and do a tertiary. Nobody wants to do that. That's the medical student's job. I will say the trauma, like the medical students play a vital role. Like if there's no med students, that place will collapse. So you have a purpose, which is a good thing because, mindless, like a lot of, rotations, you're just doing like useless, writing notes that don't matter, doing things that don't matter. But at least in trauma, your role is very defined, and you know that if you don't do what you're supposed to do, the whole service will crash. So, got some chicken tenders and some fries. Diet Dr. Pepper. I just need a little bit of more caffeine just to last the 6 hours. I feel like the night's gonna get really slow, and like that wave of sleep just slaps you around like 4 a.m. and then those last 2 hours just drag. So just get a little bit more caffeine in me. But yeah, all in all, man, my surgery rotation, it's been cool. Like I know I want to do surgery, so I guess I kind of tolerate it. But I really couldn't imagine like being on a surgery rotation and not like knowing or not liking surgery, because I feel like you'll be miserable. It's one of those like you got to get through it rotations because everybody gets through it. You know what I mean? Like, and even if you do want to do surgery, it's still kind of it's still busy work and doing like things people don't want to do. But You just gotta suck it up because everybody else gets through it. It's one of those kind of deals. So like nobody feels sorry for you because everybody has done it. So what's up with it, man? It's 2:33. Finally having a plan and a disposition for everybody, so things are finally starting to slow down. Real quick before I got too tired, I kind of want to talk about like my study plan for the surgery. So I don't think there's like a tried and true like surgery resource. There's like Pastena and Dervigilio, but like reading books was never my strength, and I don't really like reading like that. And there's only like 200, like 250 euro questions. I really don't like past tests like that. I mean pre-tests like that. So I didn't really want to do the pre-test questions. So I ended up using AmB's. And AmB's had like 700 questions. So all in all, AmB's plus euro is about 800, 900 questions. So that's really my plan, man. Run through all the AmB's. Run through all of euro. Run through as much as AmB's as I can. Obviously Anki every day. And then the last week, I may read Pastena. Pastena's not a bad read. It's like it's not a big book, so I may read it the last week or something like this week. And then all the AmBs, of course. Like the formula really doesn't change. You know what I mean? You expose yourself to as many questions as you can. You do daily spaced repetition. You know, make sure that the things that you know you remember well, the things that you have struggled with, you see again. And then all the AmBs, because that's as free game as you can get. You know, that's as much like you can see without like being on the test. And that's about it. I will say this as well. If you have any control in your schedule, like doing internal medicine before you do surgery will make your life 20 times easier. Because they're not gonna ask you like, oh, what's the surgical approach in this like disease, or what nerve are you gonna like not like ligate, you know what I'm saying? They're just gonna ask you disease process, surgery, or medical management. That's the thing, you know? So you have to be able to diagnose all those things that you learn in IM. But then the next question is this patient going to the OR, or is this patient getting treated with medical management? And that's the big thing with surgery, you see what I'm saying? So taking IM before surgery will just make your life that much easier. Anyway, that's really all for study. Maybe I'm tired, not really going to well. And that's really all I'm gonna do to study for this shelf. Feeling pretty okay about it. I mean, surgery is also hard because you don't have as much time in surgery as you have in other rotations. So you really just have to be efficient, like from day one, just really be effective. And I think also taking IM for surgery just makes that process, one, easier, and then two, you know, do as many questions as you can and you'll be straight. Anyway, I'm about to go watch Game of Thrones until it's 2:36. I got like 2 hours, so hopefully it stays slow and then like make time go by quicker. Hey man, I'm free, bro. I'm free. No more 24-hour shifts. Well, maybe like 9 to my sub-I and away rotations and those kind of shifts, but no more general surgery, 24-hour shifts. I don't think I've ever been happier in my life. As soon as I started watching the show, Game of Thrones, like clockwork, 2 traumas. And it's a lot of nothings, you know, like parents over. It's okay. I'm done. I'm free. I'm tired. I'm about to just go home, go to sleep. I'm gonna wake up when my body wants to. That's 24 hours, man. Medical student, trauma shift. Until next time, you know what it is. Stay humble, stay hungry. Let's get it.